Can everyone hear me okay today? I noticed my screen was glitching a little bit during the music. I'm hoping it's not affecting on your end. Okay, wonderful. Well, welcome to the Oregon Department of Human Services Self-Sufficiency Partners Meeting. We offer both ASL and Spanish interpretation. Please use the interpretation icon below to select how you would like to participate in our meeting. We are also offering the CART transcription services. Self-Sufficiency Programs is committed to developing and deepening our partnerships to provide outstanding and culturally specific services and supports to people in Oregon. This means listening, learning, and working together across ODHS programs and state agencies with the 9 tribes of Oregon, community-based organizations, and members of Oregon's communities. This virtual meeting occurs monthly and is a forum for updates, discussion, feedback, and Q&A about self-sufficiency programs and other related subject matter. This meeting is recorded so that we can share the meeting along with the presentations and minutes to those partners who are unable to join us today. The follow-up email with all corresponding documents and links will be sent in 1 week. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is really helpful to us and partners for connection purposes. So I'm going to take a moment and do that right now for y'all. All right, on today's agenda, we have presentations on family preservation, the 1115 waiver, and SNAP training and employment. Presenters, we do ask that you turn your cameras on while presenting where able, as our partners appreciate seeing the person who's speaking. Of course, we'd also like to invite all those that are willing, able, and comfortable to share your cameras as well. We would love to be in community with you, and seeing you makes that so much easier in this virtual space. Before we move on to our first presenter, I would like to talk really quick about our meeting time for 2024. As you may have noticed, I have not sent the meeting invites yet for next year. We did have a request to change the day and time for the meeting, and I sent a survey out to find out preferences, but that response was unclear. So I wanted to take a moment right now just to hear your thoughts. Would you prefer at this point that we keep the meeting at its current time or change it? You are here. So obviously this time is working for you. And so, your feeling on this is very important. If you want to come off mute, you're welcome to, or you can put it in chat and I'll look at chat. Whatever is best for you. So I got one person who says same time. Oh, there we go, a few people. Okay. All right, I'm getting lots of the same time. Okay, great. I would hate to change the time when I did get responses from some people who that works better for, but the number of responses I got that it works better for is smaller than the amount who usually attend this time. So I want to make sure that if we make a change, it's best for the group on as a whole here. So, all right, well, thank you. So what I will do then is I will make sure that I get those invites out to you right after this meeting so that they get onto your calendar. I know that having them on your calendar as soon as possible is really helpful for planning purposes. So first on our agenda, we have a presentation from Family Preservation. So is my presenter here for that one?
I'm here.
Awesome, thank you.
Okay, can I get started? Sorry.
Absolutely, the floor is yours.
All right, let me share my screen. And, okay, first of all, thank you for inviting us to present in the first place. We're very excited, me especially. So let me So just start with some very brief introductions. I'm Akila Nikanti, she, her pronouns. I'm the assistant manager for family preservation. And this, I see already that this is an old introduction slide, but we have Erica Haurigi, who's also on this call. She's actually our OPA 3 for SSP. So that means that she's really working with districts and coaching and supporting staff directly about how to implement that family preservation work and bringing that SSP lens. Her counterpart would be Amy Osborne, who has that child welfare lens, and then Lydia Sturba, who is the PA3 with the child welfare lens, where she's really working around identifying the structure and what that looks like statewide in terms of family preservation. And my role is really focused around community engagement and building those sustainable community partnership structures. So that being said, we're also hiring. So if you happen to know anyone that is interested in joining our team, we're hiring 6 other PA2s who will be really focused on contracting and working with community partners in developing and strengthening those relationships with each of our demonstration sites, and then our PA3 as well with the SSP lens. So that would be Lydia's counterpart, really focusing on the structure of the processes that are working. And at this point, maybe y'all are, while you're talking about family preservation, what does it even mean? I wonder if we could, I guess with a show of hands, the little icon on the bottom, can I just see who has heard of family preservation as part of ODHS, I guess I'll say. Okay. Great, exciting. We have a few folks. Unsurprisingly, a lot of them are from ODHS, which makes sense, which is good, actually, I'm glad. But as I'm describing what it is, first, I just want to ground ourselves. This is kind of how we start our introduction of Family Pres with our demonstration sites as well. I want to ground ourselves in the vision for transformation within child welfare and the vision and action for SSP side. So first, the vision for transformation, essentially a set of beliefs. First, it means that we believe that our system is actually going to transform when we believe that children do best growing up in their family and on values that are related to honoring and supporting cultural wisdom. And this means, you know, the way that our team talks about it, it really means honoring how folks have used their own resilience and strength to overcome some of the harms that the system has done to them, and then working to transform the system so that it repairs this harm and supports those folks in the ways that they need. Building community resilience and voice. And again, this means to us giving our families and those folks that have lived experience with the system the space and the decision-making power to ask for what it is they need, from who they need it, when they need it, and how they need it. And finally, ensuring the self-determination of our communities of color. And to us, this means sharing power so that our communities of color have the choice and the ability to decide for themselves how they're best served. And most of the time, it might not be by us. It might be from our community partners in their own communities themselves. So we believe that when we serve communities that are most vulnerable to the system or most impacted by the system, then usually everyone else is going to benefit as well. And then in SSP, the vision and action says that we believe everyone in Oregon deserves opportunities to thrive and reach their full potential, and maximizing people's potential helps our communities thrive and benefits our entire state. So when we talk about family preservation, the way that we've started to kind of share it is that our family preservation is one approach that is going to actualize, it's a new word that we're trying out, actualize vision for transformation and vision in action by supporting systems and shifting to prioritize keeping, oh my goodness, keeping families together and in their communities. How families and communities tell us what they need, when they need it, how they need it, and who they need it from, and we deliver. And I just want to say this, you know, the wording on this is, of course, ongoing, but a year ago, we kind of convened a group of folks that included tribal members, included folks with lived experience, families, people and community partners, SSP folks, child welfare folks, pretty much everyone. And asked them, what does family pres mean to you and what do you need from the system? And they basically said, we need you to butt out of it. So from that, that's what we're trying to do. And I do want to acknowledge too, I'm sure you all are aware, when we're talking about system change, we're talking about years and years and years to actually shift how things are operationalized, how our day-to-day work is happening. But at this stage right now, we're really focusing on shifting mindsets and identifying how can we, as we're listening to the staff and listening to families, how can we shift the structures a little bit at a time to support this shift in mindset so that every single day, every person that works for the agency is thinking, how can I provide this family or this person with everything that they need to stay connected to their people? And of course, family preservation is only one path towards this big, huge vision. There are, of course, other paths that are also at work in a variety of other systems. And we're definitely not saying that family preservation is a solution to all problems. It absolutely is not. But we do think it's one way that we can work toward that vision. So right now we have two cohorts of demonstration sites, which are essentially these districts that you see colored here. Cohort 1 came on board about 1.5 years ago, and cohort 2 just came on about a couple months ago. So what we're talking about when we say demonstration sites is that that's where we're focusing our energy, our capacity, our resources to really understand from those communities and how things are working in those unique areas. How can we begin strengthening the family preservation work that folks are doing? And I just want to emphasize too that that doesn't mean that family preservation is new, because what we're learning from Klamath, for example, from Jackson Josephine, from Washington County, folks have been so creative and innovative in trying to figure out how can we navigate all of the barriers that the system has created over the years and kind of find the loopholes to be able to connect families with the community partners and with their communities. And our job is to really figure out how can we shift the looking for loopholes piece to actually being our day-to-day practice. So when we're practicing family preservation as staff, it means that we're thinking always about serving families and children equitably in their homes and communities instead of foster care, collaborating with community agencies, families, tribes, and across both child welfare and self-sufficiency programs with the family to meet families' needs. And finally, supporting, sharing, and growing local innovations and evidence-based services that help us serve families in their homes and communities. And I do want to say too, evidence-based services is kind of a tricky term. The way that we're thinking about it, evidence is what families are telling us that they need, because a lot of times not all voices are represented in the research that goes on to create those evidence bases. So the way that we see current ODH as practice is we have a whole bunch of different groups that are working really hard to serve families and youth. You can see that families and youth here are right in the center. And somehow what we keep hearing from folks, and we've been hearing for a long time, I'm sure you all have been hearing it as well, is that people are working really, really hard to support families and connect them to the resources they need. And we're still coming across barriers no matter how hard folks are working. And those barriers are really preventing folks from being able to bridge families to those resources. And some of those barriers are that there's not always capacity with community partners. Sometimes there's no local community program that even exists to support this very specific youth or specific identity. And sometimes families just barely don't meet the eligibility requirements, which we see a whole lot. So looking at this visual, this is our current practice, and what we're hoping to do is shift. So a little animation here. What we want to do is expand those self-sufficiency services by shifting how we're thinking about eligibility and who deserves certain services. So building capacity for us to be able to offer clear economic supports. And you can see community organizations also expanded. So that means expanding the capacity of our community partners so that we can strengthen community networks, and similarly with tribes too, where we're able to listen to our tribal partners about what it is they want from us, how they want us to be involved, and a lot of times for us to step out of the way when necessary, and us being able to build a structure and culture that's necessary for us to do that. And when you see the child welfare circle shrinking, what we're thinking about is really focusing upstream so that we're setting up families with everything that they need, so that our Family Pres team is interacting with them early and often based on what the family is asking, and preventing the need for them to ever come into contact with child welfare in the first place. So we're only serving the families that absolutely need our intervention. So that being said, our 2024 community engagement goal, and particularly, the work that we're doing with our demonstration sites right now, is to build the structures that are going to allow sites to, one, these are two separate goals, but similar approaches, I would say. One, to be able to listen to the needs of people that are impacted by ODHS systems, not necessarily only child welfare or only SSP, but ODHS, and to be able to partner with those folks with lived experience in the solutions and figure out what it means for the agency to be accountable to families. And next, we want to create the structure that allows the demonstration sites to partner with community-based organizations in actually addressing the structural, financial, cultural, and capacity barriers that are identified by community partners. And when we say sustainable, a lot of what we're thinking about is the history that our agency has in reaching out to community partners and saying, what do y'all need? Can you help us? Can you connect us with your families that you're serving? Can you connect us with this? And then we never follow up with community partners, and we kind of break trust in relationships. And so our goal is first to repair some of that and create a feedback loop so that there's a clear path for the agency to be able to respond to what the communities are asking for. And one distinction that I want to make with family preservation and family first, which I'm sure you all have heard of, is that family first and family pres are going to be working together it overlaps pretty well, working together with the districts across the state to connect with local communities through community forums that might already exist. And through family preservation, we hope to work with the leadership at each of those districts to create that sustainable long-term structure that's going to allow community partners and folks with lived experience in the system and the agency to collectively figure out what the barriers and solutions are to keeping families together in that specific community. And through Family First, our goal is for our Family First team to be able to join those community forums and listen to what it is that communities are saying that they need in terms of the services that they need for that community. And we think of it as a money tunnel, essentially, where our Family First team gathers that data and is able to incorporate it into the amendment to be able to allocate federal funding to those communities. And the work with Family First is primarily happening over the course of the coming year. And we likely won't be able, they'll likely be able to learn a whole lot based on what the work that family preservation is doing with communities. I feel like I said that kind of in a confusing way, so feel free to ask questions. But that's all the presentation I had for you all today. So let me stop sharing so I can see your chat and everything. Any questions or comments at all?
So we do have about 2 minutes. If folks have questions, this would be a great time.
And Erica too, on my team, feel free to jump in if you want to add anything.
Great job. I think one thing I would just share is from some of our demonstration sites, the change that they experience when they go into the community, because we are treating it differently and more about what families need, has been inspiring to hear how, wow, we've never experienced this kind of interaction with child welfare and self-sufficiency. So I would just share that little piece of nugget to hold on to, because I think it's slow, but it's coming, and that's the change that needs to be made.
Thank you, Erica.
I'm not sure if it was something I missed, but is there some like a time frame that you're working with families with family preservation?
No, Family preservation. So the way that we're focusing our work right now, or thinking about focusing our work, is really to support the families that are shared across SSP and child welfare, and really understand what's needed there, and then expanding to our reunification group, and then expanding to all of child welfare to be able to shift pretty much how child welfare itself is interacting with families, so that we're always focusing on keeping families together. So hopefully Family Pres will be around for as long as we know.
Thank you for that beautiful presentation. It was a really good rundown on just how we're taking the vision of transformation and really making it something that it needs to be, and really keeping children at home for all the reasons that we know. If we as community partners want to become more involved with this initiative, do you all host sessions or work groups or anything that we can learn about today to be able to attend in the new year?
Yes, absolutely. So we have a community forum where we bring community partners all across Oregon to be able to connect and brainstorm with them. So I will put my email in the chat. So if folks reach out to me, I will get you added to that list to make sure that you're invited to those. Great. Thank you, Claudia, for asking that question. Okay, there's no other questions. Thank you all for your time today.
All right, thank you so much. All right. Up next, we have a presentation from Jessica. Is Jessica on the call?
I am.
Awesome. This is for the 1115 waiver. Go for it.
Yes. All right, one moment while I share my screen. And if I could just get quick confirmation that you all are seeing my screen successfully.
We see it.
Excellent. I will apologize. The way my screens are set up, I have to look away from the camera to participate in my presentation. So just know I'm here. My name is Jessica Diaz, she, her pronouns, and I work in community engagement with Medicaid at the Oregon Health Authority. I also have a colleague, Ashley Hewling, who is here, who will be here as an additional expert and also note taker, and so that we can make sure if there are any things that you want to hear more about, you have questions or concerns about, we can bring that back to the folks who are working on our 1115 Medicaid waiver, which is what we're here to talk about today. And I have altogether too many slides to cover in the time we have, so I'll try to be best judicious with how we continue this, and just know that if there's anything that you really want more information on or to focus on, let's have this be the start of a conversation. So for our agenda, it's really setting the stage on what we are talking about when we talk about an 1115 waiver. Talk a little bit about one specific part of the waiver called health-related social needs services, touch on an upcoming funding opportunity for organizations who provide services, and then I hope to have at least a few minutes so that we can have some conversation. So just to make sure we're all on the same page, because there's a lot of state jargon in this process, when we're talking about a waiver and a Medicaid waiver, we're talking about a partnership between the federal government and state governments, where we each have a general set of rules that we have to build from in order to get Medicaid funding. But we also have ways in which we can adjust what that looks like in each state. And that's not only because it's a way to sort of foster innovation and new ways of doing business, but also how we can make Medicaid work in our local context and not only be talking federal speak. So we have a Medicaid waiver. We actually have multiple waivers, so I'm just here to talk about one of them. And we have been on this waiver process trying to do new things to be more flexible, to add in more services, to maybe cover things or people even who are not written into those standard set of rules. We've been doing this since 1994. It's a 5-year process where every 5 years we come up with new and interesting things to try. The federal government says, yes, you can do that. No, you can't do that. Here, let's talk about the best way to make this happen. And then we report back. And so we're constantly changing what we're trying to do to grow out what Medicaid can do here in Oregon. And our current round was officially approved, although it's confusing because some aspects haven't and are still under negotiation, but a vast majority has been approved as of late 2022. And we have through September of 2027 to demonstrate what we have set out to do. When we're talking about this round of the waiver, we have a foundational goal of addressing and advancing health equity. And then we have a few, I'm not going to read all of these points off, but they're essentially ways in which we are hoping to address and advance health equity and make our healthcare system more equitable, culturally and linguistically responsive. And for anyone who has worked with Healthier Oregon and that expansion of OHP, we are building that into our waiver as well. So I want to call that out. Now there's a lot of different pieces to the waiver because we were very ambitious this time around. And some of them are already happening and some of them are more complicated and are taking longer to get fully up and running. So there are some things such as expanding children and youth benefits and adding continuous eligibility so that people get to keep their OHP for 2 years if they're 6 and older, and from birth to 6 years for infants and young children. I'm not going to talk about that today because it is operational and it's going pretty well. And I really want to focus on these health-related social needs services with you. But just know that there are other aspects of the waiver. And if you grab me some other time, happy to talk at length about them. But we are thinking that you are probably very interested in our health-related social needs services that we're rolling out. And when we're talking about health-related social needs, we're really talking about all the things that affect someone's health and well-being that isn't their medical care. So there is the broad definition of health-related social needs, which is really all-encompassing. And then there is the narrow definition of health-related social needs, which is what the federal government has given us permission to focus on this time around. And so you'll see at the bottom of this slide, that's where we lay out the ones that we have gotten the go-ahead to start to implement services and supports. And that's housing, nutrition, climate, and then some outreach and engagement activities to tie these all together into Medicaid systems. I'm belatedly realizing I cannot see the chat. So if there's anything, I can see faces, but not the chat. So please feel free to raise your hand if there's something that comes up.
No questions so far.
Okay. All right. And when we're talking about these housing, nutrition, climate, and outreach and engagement supports, let's talk money first, which is that we have $904 million available for the provision of the services. And so the way that that will work once it is operational is that someone who is a health-related social needs service provider will provide eligible individuals with one of these services that we're covering, and it's a reimbursement model. I want to be very upfront about that because that's a limitation of our Medicaid system. But we also know that in order to do any of that, people need to have funds to build into our systems. And so we have also been able to set aside $119 million specifically for grants that will help build capacity and infrastructure for organizations who are interested in becoming those health-related social needs providers. And we are calling that the Community Capacity Building Funds. And I have more slides on that. And if we have time, we'll dig in more. Otherwise, I'll give you this presentation to use as a resource. I mentioned briefly some of the aspects of the waiver that already went live. We do have the HRSN, sorry, health-related social needs. I get so used to my acronyms. I'm not trying not to say the acronyms out loud. When we're looking at climate, housing, and nutrition, we do have a bit of a runway for that. So we are currently scheduled to have the climate benefits go live in March of next year, which is only a few months away. Housing is a little more complicated, and we are phasing that in over time, and it is going to start in November of next year. And then only 2 months later, well, actually, I don't know. That used to say January 2025, but I want to make sure I'm not talking out of turn. In 2025, we expect the nutrition benefit to go live. So there are different pieces that we're building at different times so that we can really intentionally roll out these services and learn from the steps. So I talked about the cool things, and now I have to talk about some more of the limitations and the really specific framework that we're working within. And that is that not every OHP member is going to automatically be eligible for these health-related social needs services. We have to prioritize certain populations. And so we have a few different eligibility criteria. What's not written here, but I think is number one, is someone has to be on OHP. So someone has to be on OHP, and then they have to meet both a covered population criterion, as well as clinical and social risk criteria. And we also have very specific rules that we can't replace, we can't supplant any programs or funds that are already active for people. So we have to show that we are offering something new. And also, I could get really deep in the weeds on each of the services and each of the populations, but we're building that right now. So I don't want to bring something too half-baked, and also it gets really complicated, but just know that there may be additional criteria for some of the very specific pieces, and that's through that negotiation process with CMS that some of our limitations have been codified, they're written down. I'm also not going to read through all of these, but I do just want to show you what it is looking like as we talk about who we are prioritizing and who we have written into our agreement with the federal government will be the covered populations for these services. And so you'll see a priority on people who are homeless or at risk of homelessness, people who have dual status with Medicaid and Medicare, youth involved with child welfare, including those who are leaving, looking at incarceration and other similar factors to really prioritize populations who we know are priorities, and then adding in an additional layer of priority populations. This is where I have to say these are proposed. This part is not written yet into the agreement with the federal government, but we are proposing that we really specifically look with an equity lens at populations in this purple column here. Here's another slide that I have to admit, I'm showing it to you so that you see that it is here as a resource later. It's also under that category of things that are proposed and we are finalizing. But when we talk about clinical risk factors, we're looking at things like the risk factors on this slide. You'll see pregnant postpartum, children under 6 years of age, people who have needs with their assistance with activities of daily living and those instrumental activities as well. And so you'll see there are various clinical risk factors that are being finalized. I like social risk factor because it's a lot easier for me to answer that. It's, do people want and need what we're offering? Because if we're offering something that someone doesn't need, then let's not try to give it to them. Let's really make sure that we're aligning with that first. So I feel a lot more comfortable talking about social risk factor compared to clinical because I am not a clinician, but I just know that this is another piece where we're hard at work and actual clinicians are hard at work to help us make this. All right, I'm going to round out the presentation really quickly with a little more about the community capacity building funds. And I'm really hoping that folks who are in this virtual room might see yourselves as individuals and organizations for whom this might be useful. I mentioned that it's $119 million that we can spend. We are going through a route where we are building with the CCOs the process by which people can apply and get these funds. So CCOs will be administering them. It will be through a standard application and budget request template that is made and standard across the whole state. And there will be plenty of opportunity to apply. I believe, Ashley, this might be a place where I'm gonna fact check with you. March of 2024, I believe, is when this process is going to open. I don't think it says it on my slide deck.
That sounds correct to me. Between January and March, the CCOs will be reaching out to organizations who have expressed interest to start the process. And then in March, the actual applications would go out.
That's really helpful context. Thank you. And thanks for keeping me honest too. We have goals for why we built this into our ask with the federal government, which is we really want to make sure that we are prioritizing the specific amount of funding for people to become health-related social needs providers. Knowing that many of you all who work for community-based organizations, you probably provide similar services to what we are seeking to cover, but probably not in the way that is going to make the Medicaid part of this work. So we want to really focus on giving you the funds you need to make that real and realistic. We want to make sure that this is spread across the state, that we are engaging folks along the way as we design these programs and this funding. We want to make it as easy as possible. We want to make sure that this is not just something that is available for the folks who already know how to speak and use Medicaid systems, and really looking into those populations, those priority populations, looking into who has been most historically impacted by the inequities in our systems here in Oregon, and really putting the funds there. And then I'm saving this for last, even though it wasn't the last one on the list, which is I want to call out that we also have a set aside for tribal governments that is separate from this process, to honor that government to government relationship as we build this program. This is mostly just so I have a chance to say, if you think you might qualify, you probably do. Pretty much anyone who provides any social services can potentially apply for these funds. And then just to also make it really clear, I talked to something that confuses even me from time to time is we have these different pots of money and what are they for, what's allowable, what isn't. When we're talking about the $119 million, we're really looking at ways in which people are building and buying technology, having the capacity to develop their practices, their business or operational practices, ways in which we can support workforce development and hiring, and then that outreach education and gathering of people together. So you'll see there are things that are on this list and there are things that are not on this list. And the one I really want to point out is you can't use these funds in order to provide people the services. That's that other pot of money, and that's the reimbursement model. And you can't build buildings with it. So those are the two things I know come up fairly often, and those are no-goes for this particular funding opportunity. I'm going to leave this as a resource for you later, but there's some information to expect on the application just to make sure that we are really prioritizing language access and a good geographic spread for our grantees. When I say our grantees, the CCO grantees, we're all working in this together. All right. How am I doing for time?
So I was just going to jump in. We're 4 minutes over. And so we won't be able to take questions aloud right now, but if folks want to type questions into the chat, we'll make sure that we get those answered and provide them in our follow-up that we send out next week. You're welcome, of course, to answer them in chat as well, but we will include them in the follow-up to make sure everybody gets their questions answered, even though we can't do it in this space right now. So I hope that's okay with everybody.
Perfect. Thank you so much, everyone. And I will also drop in some contact information so you can reach out to us. And I will
Great,
make
thank you.
sure, Misha, that you get the slide deck.
Perfect. Thank you so much. Appreciate it. Sorry we didn't have time for the question and answers. Got lots of great programs presenting today. So last month during our partner meeting, we had an overview presentation of the employment and training programs offered by self-sufficiency programs, and then with the promise that we're going to dig into the programs more over the next few months. And so today we have Sarah from the SNAP Employment and Training Program who's going to speak with you. Sarah.
Thank you, Misha. I'm going to jump right in and just share my screen. If I could get a head nod or a thumbs up that you can see it.
We see it.
Perfect. Thank you. All right. I'm going to put this to the side. Great. So good afternoon, everyone. My name is Sarah Cleaver, and I am one of the SNAP Employment and Training Programs Policy Analysts. I want to call out that we use a ton of acronyms as well. I know it's like a whole different language when we start talking about employment and training programs. You're going to hear me say ENT a lot. I'm not referring to the ear, nose, and throat doctor. It really is the employment and training program. I'm also going to throw out STEP and ABOD, and I promise I will define those for you as we go along. So in general, our ODHS, Oregon Department of Human Services, SNAP ENT programs are set to really develop the resources to provide our participants with opportunities to access education, training, and employment services, those of which are offering that really strong pathway towards economic stability. Overall, the goals of our SNAP ENT programs are, to offer those employment training and education services to folks across the state. We're here to make sure that there's equitable access, and we're offering services to underserved populations. We're also here to make sure that there's a continuum of services. So when you're thinking about families who might be transitioning off of TANF, Temporary Assistance for Needy Families, or Cash for Families, offering that service to help them transition off of that, maybe into a SNAP ENT program for some continued access. SNAP ENT is also looking to really develop those resources for individuals and for families to have that safety net, really stabilize and develop their own pathways into stability. So there are two different SNAP ENT programs across the state. The first is STEP, so that is the SNAP Training and Employment Program. Nationally, it's called SNAP 50/50, if you've heard of that. The other one is ABOD, that's Able-Bodied Adults Without Dependents. And so the purpose of both of these programs, once again, it's really to assist folks who are receiving SNAP benefits to obtain skills or training, work or experience to increase their ability to get those living wage employment opportunities. So these programs serve folks all across the state. We do have services through STEP or ABOD in all areas of the state. Our programming does operate on the federal fiscal year, which may seem a little bit different than some of our other programs. So that runs from October 1st through September 30th. So right now we are in federal fiscal year 2024. It always feels a little bit weird, October 1st, we're in the next year already. For this federal fiscal year, we have 28 contracted providers and 28 subcontractors. So that's a total of 92 sites across the state. And we're anticipating to serve 33,486 people. So a lot of folks getting services from us. That said, we have an awesome team. There's three of us. We have our program manager, that's Candy Quintal. I believe she was here last month presenting the overall employment and training program, both STEP and ABOD and jobs. And then for the SNAP side, you've got me, Sarah Cleaver, one of the analysts, and we also have Jennifer Granera. So our team, myself, Jennifer, and Candy, we really work to collaborate with, other ODHS or department programs, different community agencies. So we're thinking about program delivery, contract development, coordinating with other policy teams or program teams, updating those policies, providing guidance for implementing the program, doing audits or reviews, connecting with ODHS field staff. There's a lot going on, but ODHS does retain the oversight of this program. So at the central office level, we are the ones holding those contracts, and we are providing the program oversight. So that's ensuring all those services that are available, that they're being provided to folks who are eligible, who are appropriate, and that we're providing culturally specific and relevant services. We're overseeing the budget and program expenses, program administration, that contract execution and compliance. And then we're also here to ensure that there's collaboration between all of our providers to meet the needs of each individual local community. Digging in just a little bit more, I'm going to talk about STEP. So once again, that's the SNAP Training and Employment Program. So the Food and Nutrition Act requires every single state across the country to implement a SNAP Employment and Training Program. We, through work with our partners, decided to call it STEP. It just rolls off the tongue a little bit easier than SNAP 50/50. So we developed the STEP Provider Network. So that's focusing once again on those employment training opportunities, really helping folks, access these services and build their own path. STEP also allows for a 50% reimbursement of costs to these contracted providers. And that's 50% reimbursement of any allowable program costs or expenses that they're incurring. For the STEP program specifically, we have a total of 55 providers. So that really ranges from community organizations to other government agencies, community colleges, and we also have one of the four-year universities as a STEP provider. Each provider gets to select what kind of services they're offering. So that could be educational services, job searching support, it could be offering kind of supportive items to address individuals' needs like work clothes, transportation support, or even housing payment assistance. Now, each provider gets to determine the specific services that they're going to offer. That's based on their own agency's goals, their staffing, their budget. And then us at the central office level, we help them keep in alignment with any requirements. So you might wonder who can engage in STEP. It has to be someone receiving SNAP benefits. They have to be 16 years of age or older, and they cannot be eligible for the TANF jobs program. That's that Cash for Families employment program. So if someone's not getting SNAP benefits, if they are eligible for jobs, if they're under 16, so if they're 15 or younger, or if they're not authorized to work in the United States, then they're not eligible for STEP. Pretty much everybody else. So that's how we get those 33,000 participants. ODHS as an agency does determine the eligibility for this program. So any of our providers are not determining whether someone is eligible or not. So that lies on us, and we collaborate with the employment department to use their iMatch skills system. So we do a data transfer every night between our eligibility system and the employment department to display that eligibility in an individual's iMatch skills profile. That's where our contracted partners come in. They utilize iMatch skills to make sure that they're confirming if the person is eligible for STEP. They're recording any services that are provided. This is how our providers can collaborate very easily with one another to offer these wraparound services. And they can connect with any other providers or even ODHS staff to help support that participant. Now, the other program that I mentioned is ABOD, that's the Able-Bodied Adults Without Dependents program. And I'm not going to spend a ton of time on this. I know there's been a lot of different presentations about ABOD here in the past, so kind of high level for folks who may not be aware. ABOD is when folks are receiving SNAP benefits, they might have an ABOD status. So that means if they have an ABOD status, they're limited to SNAP benefits to only 3 months in a 3-year period, unless they're completing some additional work-related activities each month, or if they're meeting an exemption. So individuals who are between 18 and 52, if they do not have a child under the age of 18 on their SNAP case, they are considered to have an ABOD status. So I mentioned, unless they complete work requirements, right? So that could be one completing completing 80 hours each month, either by paid employment, working for pay through an employer, could be unpaid, maybe doing some volunteering or bartering work. Folks could meet these requirements by working with our contractor, the employment department, to do different work-related activities as part of a case plan, maybe doing some job search, work readiness training, vocational training, things of that nature. Could be in combination. They could be doing some stuff on their own, also be collaborating with the employment department to meet those 80 hours. Now, some folks don't need to meet those 80 hours. They may be living in a waived county or on some waived tribal lands. They could meet a number of our exemptions. I won't go through the whole list. There's a whole mess of them. Maybe someone isn't able-bodied. Maybe they themselves have some form of disability or restriction, physical health, mental health, behavioral health. Maybe they're providing care for someone with that type of situation. There's a bunch of different exemptions, and like I said, I won't go through the full list, but I will drop that link in the chat. We do have the ODHS SNAP Employment and Training webpage online with a lot more information about those work requirements, who has an ABOD status, what they have to do, and how to get more information. The piece I do want to highlight is that starting on January 1st, so 2024, the only counties in Oregon who will be implementing these time limits for individuals with an ABOD status will be Multnomah and Washington counties. So once again, if you're curious about who's implementing time limits or what meets an ABOD definition, check that website, and we'll throw it in the chat as well. Talked a little bit about what the programs are. Here's a slide. Once again, not going to read it to you, but there's a ton of different services that folks can engage in if they're working with STEP or ABOD. I mentioned some job search. They could do some work readiness training. Maybe they're doing some vocational training. There's a whole wide array of services. But each provider, as they join that provider network, they get to decide which services they're going to be offering. Each SNAP ENT contractor or provider have to apply every single federal fiscal year. So they complete a proposal packet. They do an outline narrative of all the services they're going to be providing. They outline their budget, and they submit that to us, the central office SNAP ENT team, by April 15th of every single year. We review those, we approve those, we send them up to the United States Department of Agriculture, USDA, Food and Nutrition Services, FNS, for final approval in our SNAP ENT state plan every single year. I do recognize time, so I want to highlight one additional piece. We have some great supports out in the community, and those are our STEP navigators. They really are local subject matter experts on the STEP program, on the services, on the contractors that are in your area. So if you have any questions, feel free to connect with the central office team, connect with your local navigators. They are lovely people. Can't say enough good things about them. If you've met them, I am sure you agree. I'm going to cut that a little bit short because I want to allow any questions or comments from the audience, and put a couple things into the chat.
So we did have a question that I think I saw folks from the SNAP team here that could answer that. So Jean or Antonio, if you're here, could you answer Beth's question that's in the chat about folks that maybe met or were at their time limit, but are going to be in a waived county starting the first of the year, how that works?
Yeah, hi, this is Antonio Horas. I use he, him pronouns. I am with the SNAP team. We are working on getting a mailing out to individuals who may have lost benefits that reside in one of those counties that was previously applying time limits and are now in a waived county.
Oh, we lost you, Antonio. Were you finished?
I was finished.
Okay.
Sorry.
Great. All right. I know that Sarah opened it up for questions. I also know that we are at time. So I do want to acknowledge that folks may have other meetings and whatnot to go to. We are at the end of the meeting and want to thank you all for being here and for being such great partners throughout the year. If you do have a question for Sarah, if you want to hang on for a moment and ask that, you're welcome to, or type it into chat and we will get that information out in the follow-up. But otherwise, a really great rest of your December, and we'll see you in the new year. I will get those new invitations sent out by the end of today. Thank you.